And we'll go right into our next subcommittee, which is the Ad Hoc Committee on Drug Education and Awareness. And Sharon Cameron is again here to address the council on a lot of updates and work that the city has been doing on the opioid epidemic that has, affected everyone, everywhere. And Peabody has been doing a lot of work. And I wanted to give the residents an example and an education of all the work that has been done by the city of Peabody and these folks that are joining us this evening. It's a lot of work, and they're putting their heart really into doing the best they can to address this. And we have been doing this now for 10 years. And you've been around, I know, for 10 years with the Healthy Peabody Collaborative. It's been a long time. But I'm going to just, and on the committee this evening, joining myself as chair is Councilor Rosendahl and Councilor Turco. And we obviously have a full committee, so by all means, chime in, gentlemen. So with that, Sharon, if you could update us on what the city has been doing and all the groups that are involved and what we're doing moving forward. Thank you.
I want to thank the council for giving us the opportunity to update you tonight on the status of our efforts to address the opiate epidemic. I'm going to start by sharing some data with you and talk about some of the interventions, and then Sarah Grinnell from the Healthy Peabody Collaborative is going to talk more about what we do on the prevention side of things. So first, an overview of the data. This is the data about the number of opiate overdose responses, not necessarily fatality, but overdose responses by the emergency medical system in Massachusetts. So you can see for the whole state of Massachusetts, the trend past 2 years has been pretty consistent. The first quarter data for 2018 is right on track, very consistent with the data from the prior 2 years. But if you look at what's happened in Peabody, we had about 163 overdoses in 2016 and 2017. And our numbers for the first quarter of 2018 are on track to show higher number, 29% higher than the first quarters of 2016 and 2017. So that's certainly something that concerns us. When you look at fatalities, again, you look at the trends in the state, and we had an increase followed by a decrease last year. The first bar, the orange bar, is people who live in Massachusetts, and the second bar is when the darker bar is overdoses that actually happened in Massachusetts. So when you look at what's going on in Peabody, there's been a little bit of a decrease prior to this past year in terms of the number of Peabody residents who had a fatal overdose. But last year, we actually had a significant increase. We had 23 residents in the city who had a fatal overdose, and that's obviously very concerning. The darker bar is people where the overdose occurred in Peabody. They weren't necessarily Peabody residents. That number has been pretty stable, but the number of Peabody residents who overdosed either in Peabody or outside of Peabody and passed away has increased. One of the initiatives, we do have an opiate overdose prevention task force in the city, and we've got a lot of partners. We've got Councilor Manning. We've had other participation from other city councilors in the past. Obviously, the health department, the Healthy Peabody Collaborative, Leahy Hospital has been part of that. The police department, the fire department. We have had the YMCA as a new partner with us, and we have a representative of the YMCA here with us tonight. We have, who else am I missing? The methadone clinic on Route 1 has participated, people from the school department, family members, and Atlantic Ambulance. So we've had a lot of stakeholders together. One of the programs that came out of that collaboration is what we call our Door Knock program. And this program is where we have Peabody firefighters who've received special training, and they're accompanied by a trained recovery coach who works for Healthy Streets, which is a response agency based in Lynn, and they make a home visit after somebody has suffered an overdose. And they try to make that home visit within a week or 2 weeks of when the overdose occurred, because that's a time when people are very receptive to receiving treatment. So they literally knock on the door, the two of them together, and they try to provide information to families and the overdose patient if they're there, and referrals to treatment. This project was funded through a startup grant through Leahy Hospital. We still do have some of that funding available to continue this program for the time being. So some of the data, the next few slides is the data from the door knock program. So we've been doing this for about a year and a half. They've attempted 68 visits. 10 of those visits have resulted in patient contact. 29 of those visits have resulted in contact with the patient's family members. One of the key benefits of this project is that they're providing training on the use of Narcan, which is an overdose reversal drug. So 11 of those visits, they were able to train family members about how to use Narcan to hopefully save somebody's life. And then I'll show you data about who the victims are. Most of the victims are men, about 80% of them, and they're in the 20 to 40-year-old age range. And this shows the month of the overdose. So you can see there are some seasonal trends, and this is just 1 year worth of data, but we'll be watching that going forward to see if it helps give us insight into how we should be targeting our intervention and our prevention messages. So just to touch briefly on some of our current initiatives around intervention. First of all, Peabody is part of a grant for opiate overdose prevention and response, along with Lynn and Salem. The three of us hold a grant with Lynn as the host community, and that grant funds a full-time coordinator who is a clinician employed by Bridgewell. We have funding for this through FY20. One of the projects they're working right now is to put together a working group to identify strategies to close gaps in accessing treatment. And the focus of that project is going to be to work with medical providers so that they can work more collaboratively with police, schools, and other outreach organizations. Another project they're working on is they'll be doing focus groups in each of the three communities with individuals who are either in treatment or who still actively are using, so they can help us understand those data trends we're seeing, why the seasonality, why the demographics of who's using, and that will help us tailor our prevention approaches and our intervention approaches. And then lastly, we will be working the City of Peabody, Atlantic Ambulance, the YMCA, and the Colton Buckley Foundation will be working together to sponsor some community Narcan trainings. Over the next few months, you'll see those trainings begin to be advertised. So that's it on the intervention side, and I'm going to have Sarah talk about the prevention aspects.
Good evening, everyone. Thank you for inviting us here tonight. I'm here representing the Healthy Peabody Collaborative. We're a bit of a two-person show, and we're normally together, so it's myself and Sandy Drover, who couldn't be here this evening, but is here in spirit as always. And so you can go to the next slide. The Healthy Peabody Collaborative was formed in March of 2008. It was a collaboration at first between the City of Peabody's Mayor's Office, the Health Department, Police Department, and School Department. They received the first source of our funding that began in July 1st of 2008, and myself and Sandy both came on board in September of 2008, so it has been 10 years at this point. The mission of the Healthy Peabody, so our mission is the Healthy Peabody Collaborative, a division of the Peabody Police Department, is focused on positive youth development aimed at reducing negative and risky behaviors, including drug and alcohol use in the community, in collaboration with all sectors of the community. That is a mouthful. So we normally go with Sandy and I like better, which is our vision, which is creating a healthier community for all who live, work, or play in Peabody, and that is really what we're trying to do. So this just gives you an overview of where we fall in the city hierarchy. We are located in the police department. Underneath the Healthy Peabody Collaborative, you'll see most of the areas in which we focus our efforts on, and then our funding sources are seen below that. Our Drug-Free Community Support Program, that provides support financially for most of the initiatives that we do. That unfortunately is ending in October of 2019, so we're just starting the last year of that source of funding. That is a federal grant that we unfortunately are not able to apply for again. We've received the maximum amount of time, which is 10 years. It was 2 5-year grants. We also have funding from the Mass Department of Public Health. That's a regional grant, similar to the opiate grant that Sharon just spoke about. That one is also ending in 2020. So within 9 months, both of our funding sources will be coming to an end. That grant is a lower amount of money, and it's also shared between 5 communities. We partner with our neighbors in Danvers and then Tri-Town, which is Topsfield, Middleton, and Boxford. We have some funding from the city of Peabody, and then we also have in-kind support from the city as a whole, and also many of the businesses, the Y, everybody in the city more or less has contributed to our efforts at one point or another. So to just give an overview, prevention can sometimes be a little bit difficult to understand what we do, but the Healthy Peabody Collaborative, we really focus our effort on promotion and prevention. In the promotion realm, we're really working to create that healthier community for young people to grow up in. In the prevention piece, we do work in all 3 of the domains listed. Under the universal domain, that would be more of what you think about policy enforcement, anything that affects the community at large. In the selective domain, many of you may be aware of the Above the Influence campaign, which is a campaign that we've been using for almost 9 years now, and that is a nationally recognized campaign. We've been recognized nationally for the success with that, went to speak with the Senate to help support that ongoing funding. And then indicated, this is where we really rely more so on our partners in the community. We don't provide direct treatment, so this would be support groups. So one example of that would be the School-Based Health Center, which Sharon was very involved in getting started. They provide a lot of support groups for young people, and that's before they get into the treatment and recovery side of the continuum of care. So over the last 10 years, it's hard for me to kind of sum up what we've done, what we've worked on and implemented. So I'm just going to give a brief overview. So we use environmental strategies. So those are strategies that are based in evidence, so they're based in science, and they affect the community at large. Some examples of those strategies that I'm going to talk about tonight are enforcement, social norms, and policy. Under the enforcement realm, our first source of funding we did a lot of was compliance checks. That's since changed. That's gone back to the ABCC, and locally we still do what we call directed patrols. We've also, what do I want to talk about under policy? Oh, okay, so another piece that we've done under policy is providing training for liquor merchants. So if they fail one of those compliance checks, the goal is never to get them in trouble or have anything happen to their license, but we're really just looking for them not to sell to people. So we've been able to provide training once or twice a year for the last 10 years, and we anticipate continuing that moving forward. So it's a tip safe server training to make sure that they're aware of whatever mistake happened and then not to repeat that moving forward. So talking about social norms, that's where a great deal of the work that we do happens. We use 2 different evidence-based campaigns for that. The first is the Above the Influence campaign, and then the second is the Search Institute asset model. We're really moving more in the direction of the Search Institute asset model as we start prevention younger and younger. The thinking used to be you did prevention in high school, and then it was middle school, and the state and the federal government are finally recognizing that if you're doing prevention, you really need to start down at the elementary school. And it's not necessarily, you're not telling kids at the elementary level to not do drugs, but you're teaching them how to be the best person they can be, the things they need to support them growing up. It's as simple as sitting down for dinner 3 nights a week or reading for pleasure, and those are all protective factors to help a young person make those better choices later on. And then lastly is the policy piece. I think that the piece that I'm the most proud of here is we were able to partner with the school department and the Rotary of Peabody and purchase an evidence-based health curriculum that's comprehensive, that's now being implemented in the public schools K through 12. We're held up oftentimes as a goal for other communities across the Commonwealth because that is such a big deal, and most school departments don't have that. So I'm actually gonna show you a video. I was trying to decide what made the most sense, but we have 2 youth groups. We have one at the middle school and one at the high school. They inform many of the prevention strategies that we implement, and they choose those. And so this was a social norms campaign that our middle school youth group developed this past year. So how we started out is we asked the middle school kids what they needed to be the best they could be. And they universally said the same 2 things. They needed to surround themselves with good people, and they wanted to feel good about themselves. So what Sandy and I did with the middle school group is we came up with an idea. Well, they really came up with it. We went to the school lunches, and they asked all of their classmates. It's okay. They asked the whole student body during lunch what helps them to be successful. And then we took all those answers and created this video. So let's take a peek. Is the sound going to come on?
I am positive. I am honest. I am independent. I am determined.
I am hardworking.
I am confident.
I am musical.
I am caring. I am athletic.
I am unique.
I'm respectful.
I am committed. I am intelligent.
I'm helpful.
I am resilient.
I am kind.
I am friendly.
So it's actually okay that there wasn't sound, because one of the things that we made sure is that when this is playing in the front lobby of the middle school, that it still makes sense with no sound, so that works. So the young people, they came together after school and they did the recording. Gravok was who did the video editing for us. They opened up their doors and we brought about 15 middle school students over to their studio. They went through the editing process. They really showed them how this video is being created soup to nuts. So we have some kids now that are interested in this process. So that's kind of an aside and wasn't the goal of the program, but it's these opportunities that these young people have are really amazing. So thank you.
Thank you very much. Are there any questions from subcommittee members? Any comments? Councilor Turco.
Thank you, Mr. Chairwoman. One quick question. After Narcan is administered, what's the follow-up? Is that the door knock program is the follow-up, or is that separate? I'm just wondering what happens after these people are brought back and we just let them go and that's the end of it?
So what we've been told by Atlantic Ambulance is there was some talk before that a lot of times people would refuse treatment, and what can happen is as the Narcan wears off, they can go back into an overdose. That hasn't really been the case for us here. They're able to get them to be transported to the hospital most of the time. So what happens is a police detective goes out and tries to talk to them while they're in the emergency room. You never know when a person may have a moment of clarity and say, I want to go into treatment, or whatever it may be. And then we have the door knock program that happens after the fact as a follow-up as well.
Door knock is a follow-up after it's been administered. They go back days later. The fire department does the door knock.
Thank you both very much, and Councilor Manning, thank you very much.
Thank you, Councilor. Councilor Sasslaw.
Thank you. I just had one question, and I had to bring it up because it was all over the news last night, and I'm just curious if you folks saw it. It was as far as reported that the e-cigarettes is in an epidemic state right now, and it's obviously very concerning. I know to a small degree, I believe you folks work with whoever does the stings or the task force. I know I've sat in a meeting, I believe it's a state level or something, but I am concerned about that. I think many of us are. And while you were here, I had to ask you if you maybe, after you saw it last night, maybe enforcing stings. I mean, they're for sale everywhere, and and I have children in the middle school, and it's there, and it's a reality. I just wanted to ask you about it.
I'll let you
sorry about that. So we're very concerned about the vaping as well, and I think you're all aware that the Board of Health has a regulation around, two regulations around sale of tobacco products and use of tobacco products, and we have redefined smoking to include vaping. So our current regulations prohibit the sale of any vaping products or tobacco products to kids under the age of 21. That actually just got passed into law statewide. It'll be implemented in January, but we had already adopted that here in Peabody. And then we also have separate environmental smoke regulations that prohibits the use of tobacco products and vaping products in public places, pretty much any public place you can think of. So we've already made those changes, but one of the things that we're very concerned about is because the strategy of the industry is to produce flavored vaping juices that appeal to kids, and also, really flashy electronic devices that appeals to their sense of wanting cool gadgets. We can't really do anything about the gadget piece of it, but we can do something about the flavor. So the Board of Health will be voting this month on whether to amend their regulations to restrict the sale of the flavored vaping products to adult-only tobacco stores like the Main Street Smoke Shop. Right now you can go into any convenience store pretty much in Peabody and find right on the counter, watermelon flavored vaping juices and things like that. Those products, if this regulation passes, would be restricted to adult-only establishments where anybody under age 21 is not even supposed to cross the threshold. So that hopefully should reduce access. And then, Sarah talked a lot about the social norms. We need to try to promote social norms around, make people more aware of the potential risks of using these products. There's not a lot of data about the long-term impact on kids or on anybody using these vaping products, but it is well known that there are chemicals in them like formaldehyde that you don't want to be using, and there's a misconception that the products are safe because there's not the smoke and people think of cancer, but we have a whole new generation of kids who are getting addicted to nicotine because they're not aware that the vape juices contain nicotine. So. But Sarah wanted to mention an initiative she worked on with the youth group as well on this issue.
If I may, I think we've had you provide such, you've been so informative on all subjects that we've asked you in advance. I think that that's such an important subject, Counselor, that we can refer it to the next subcommittee, Human Service Subcommittee, and we can allow Sharon and her department to provide us with more information.
And I appreciate that. I just have to ask one question, if you wouldn't mind. Is there anything as far as stings at all to find out which stores are maybe not, allowing these to get into the youth hands?
Yes, I forgot to answer that part of the question. We are part of a regional tobacco control collaborative. There are 16 communities, and we're part of that. And as part of that project, we do compliance checks. Depending on the amount of funding they have from year to year, it's usually 2 to 3 times a year, and every tobacco permit establishment. Right now we have 58 permitted establishments, and so they do compliance checks with underage youth, and anybody who is caught selling to a minor gets fined. If it's a repeat offense, they will also have their permit to sell suspended by the Board of Health for a period of time. So that does happen regularly.
Okay. Are you all set? Okay. And lastly, I'd like to, I do have one question, and it's about funding. But I wanted to thank you and Sarah Grinnell and Sandy Drover for all the work that you have done. It's really amazing to me that you've been a part of the Healthy Peabody Collaborative, Sarah, for 10 years. I remember when Mayor Bonfanti first kicked off this initiative, and Chief Champagne back then, the police chief, presented to us, and he said, when he presented you, recommending that you steer this initiative, he said, and she's the real deal. She really is the real deal, and he couldn't have been more right. So, and you've been around for 10 years. It's really amazing to have such commitment, such professionalism, and you put your heart and soul into everything that you do for the city. And for all three of you, you've done such phenomenal work. The city is really lucky to have you. Now, with that, if I can jump to funding, I mean, you're doing great work, and it's been going on for 10 years. But what's very concerning to me is that of all the work that you have done over the last 10 years, your back-to-back 5-year federal grant funding is running out. And now that we've been able to benefit from all the work that this program has done, it's really concerning to me. So could you tell me what your total budget number is with the federal grants and your state grants and the assistance from Peabody, so that we can know heading into budget session next year what we're looking at, because you're not going to get the federal grant. That's it, and that's how grants work. They fund you for X amount of period of time, and for two reasons. Either they figure you're going to solve the problem, or you're going to pick up the funding on your own. And back 10 years ago, when this initiative took place with the federal funding, this opioid crisis was not at all remotely like it is now with fentanyl and carfentanil and the addiction that we're facing today. So we obviously, the first portion of why federal government funds things cannot be met. We couldn't compete it, but we couldn't defeat it, but we've been combating it, and we've done such a great job here in Peabody. So it's really imperative for this council to hear from you what we need to do as a city with respect to funding. You're talking to the right people here to move forward so that we can continue the great work that we were doing, because the battle is going to continue and it's only going to get worse, and we have to have these pieces in place. So please tell us what you need from us.
10 years ago, I had really hoped I would work myself out of a job, and unfortunately that did not happen. But what we are looking at losing is the Federal Drug-Free Communities Grant is $125,000 annually. This city provides both a cash match, which is $65,000, and an in-kind match, so that we're eligible for those funds. That will be ending in October of 19, so basically 1 year from now. And then we also have our state funding, which is $100,000, and that is spread between the 5 communities, and that'll be ending in July of 2020. So they did offer, we received a 2-year extension, which is great, so that brought us to 2020, because it should have been coming to an end this July. So the total budget's $290,000. Which is, you know, in the grant world, that's a good amount of money, but really what we do is supported by the community at large, so we're able to do so much more with that. So we did write 3 different grants for different things over the summer. We're going to continue to look for any sources, but one of the issues is these are the 2 major sources of substance abuse funding. And throughout this whole opiate epidemic and the money that's been put towards it, nothing has come down that's comparable to this. So they've been mini grants or smaller pieces that are for 1 year, you know, AG settlements and that type of thing, but nothing that will take us to let us continue doing this work long term.
Okay, so looks like we're going to have to figure it out. Okay. Any other comments from the councilors? No, and I thank you both very much. Motion to adjourn?
Moved.
Oh, we have, what's Rob? One more individual who was joining us who's new is the director of the Y, Rob Lowell, and I did invite him to come this evening to introduce himself and to educate the community of what he's offering at his program.
Hi, good evening. I want to thank you for the opportunity to introduce myself and to speak to you about the Y's excitement and commitment to affect change with the opioid crisis. So I started at the Y 4 months ago, and when I started at one of our initial senior staff meetings, we had a discussion around this epidemic and what could the Y do about it. We are very early in this process, and so there really are 4 key areas that we're focusing on now. One is, actually 5, collaborating with all of the agencies in Peabody. I think it really is critical for us, but we are in the education phase, and so in 2 weeks, our senior team will be going to a 4-hour training so that we can really understand and be aware of this problem and the signs of the problem. We are going to be putting resources in each of our branches. And you may or may not know, the YM Peabody is part of the YMCA Metro North, which has branches in Melrose, Lynn, Saugus, and Stoneham. And so we're all going to be working together to help with this. So there'll be resources in all of our branches for members to be able to look at. We actually are piloting a Yoga for Recovery program. It will run weekly on Friday nights starting on October 5th. We'll be adding 2 Sunday sessions that will be Families in Recovery. All of this will be free to anyone who is in need. We'll be offering temporary memberships for people so that we can try to encourage people to have holistic and overall health. And one thing that we're going to be looking at down the road, and this is a learning that I had at our last meeting, we have an opportunity with our early learning program and our after-school program to develop curriculum for our kids before this even becomes a problem. So as I mentioned, we're early in this fight, but we are excited to work with the Department of Public Health, Healthy Peabody Collaborative, the Council, and to anyone in Peabody to help. Thank you.
Thank you very much for joining us. Welcome to Peabody, and we're happy to have you on board and have yet another organization in the community to help us address these issues. So welcome to Peabody, and thank you very much.
Thanks. We're happy to be here and happy to help.
All right, thank you. And a motion adjourned by Council Melville. All in favor? Any opposed? It's a vote. Thank you.